Today, we'll be chatting with Cameron Bishop, who will be teaching a specialty class during our conference this year. Cameron, thank you for talking with us today. This year, during the Fsoma Acupuncture and Asian Medicine Conference, you will be teaching integrating modern modalities to maximize your results. Can you tell us what inspired you and led you to create this class?
Well, my DAOM is in integrative medicine, and for part of it, I spent 6 weeks, I think, in China. And one of the places I worked was an integrative medicine hospital. And I kind of got the idea that you could combine all kinds of different medicines, if you will, techniques to have a more effective result with your patients. And in the end, the patients were happier, the system, if you will, was happier, and the physicians were happier. So I sold my practice about 5 years ago and kind of semi-retired. And I started working for Pacific College of Health Sciences. And at that time it was BCom. And they asked me to write a class called Integrative Pain Management. So they sent me a text of books and they assumed I was an expert in all this. And they said, read the books and write a 10-week class. So I started, looking through it and reading these books, and I realized I wasn't an expert at a lot of it, if not most of it. So I told the supervisor this, and she said, well, become an expert. So I'm not claiming to be an expert, but I started researching a lot. And in this class, I had students give presentations, and I think I taught 40 of these classes at least or more for Pacific College. And often they were packed with 35 students. They gave presentations and I learned from them. A lot of them were already doing integrative medicine, VA hospitals, Mayo Clinic, Cleveland Clinic, things in their own backyards or in their own clinics. For example, combining hypnosis with acupuncture or laser therapy with acupuncture or postural therapy. With the success of this class, they asked me to rewrite one of their classes called Integrative Case Management. So this class, again, students were reporting on their successes of integrating multiple modalities. So in the last 5 years, I've noticed, having researching this and literally writing the classes on it, the research is coming out like mad on how to combine yoga therapy, for example, with acupuncture. So that's really exciting. So that's how I kind of fell into this by accident. And I'm just really excited about this field. I think this is where a lot of Asian medicine is going, even in China in the research.
Oh, very interesting. And can you tell us what is the clinical application of this class?
So there's a lot of treatment ideas and combinations, biofeedback in acupuncture, hypnosis, mind medicines, how to use apps, for example, weight loss apps, or this type of thing for patients to get better patient retention, better results, have the patient more involved, and also you have a better feedback system of what's going on. It's also at the end of a treatment when the patient asks you, is there anything I can do at home? I have a list of things to suggest, easy things to do, or even links you can send to the patient. And this keeps the patient involved in the treatment. There's that old thing about if you have a great doctor and a poor patient, you get mediocre results. And if you have a great patient and a poor doctor, you get mediocre results. But if you have a great patient and a great doctor, you get great results. So this is the idea to kind of increase that relationship with the patient. And I think this is, all the things I wish I had learned in school. I'm coming up on 30 years of practice. So I wish I had learned a lot of this 20 years ago or 30 years ago.
And what are the benefits of taking your class?
Well, I kind of mentioned some of them already, but really patient retention and success, and less suffering of your patients and maybe ourselves for wondering if we're doing the best job we can. I think it's a great class to learn different ideas to get your patient through a plateau, pain plateau or digestive plateau or whatever else. Also, there's a lot of great tips on feedback systems. What are acupuncturists actually using? What works? The scale 1 to 10, they already know in research, doesn't work well. And also great communication tips to help retain patients. Things I've learned the hard way. A lot of this is Not that I'm smart or good communicator. It's things I learned the hard way. So I think there's a lot of benefits for taking this class. And with the classes I taught with Pacific College, and now at Atlantic College of Oriental Medicine, I'm teaching a similar class. The students just love this class. They just eat it all up.
And you mentioned earlier that you've been in practice for 30 years. Can you share with
Almost.
us almost? Can you share with us your professional history?
So I graduated college with a degree in psychology and anthropology, which meant I was unemployed and confused. And I went into Japan, the last century, and before the cell phone and everything else like that. And I was studying martial arts, and I got injured. So they sent me to acupuncture. So I was originally an EMT, and I worked ambulance and emergency room during college. So they had me teaching doctors in Japan English as one of my jobs. So if I ever got sick, I had 20 doctors in the room taking care of me. It was great, best medicine I ever had. So they sent me to acupuncture. I never heard of it. You got to remember, this is, I don't even want to know how long ago, but it worked, and I got interested. And at this point, I didn't even know, there's no internet to look this up, that acupuncture was in the United States. So I started studying there, came back to America, went to Seattle, got my master's. Then I didn't like cold, wet weather, so I moved to Florida. I have a lot of family here. One of my cousins is an osteopathic physician, and I worked for his office 6 years. So that was kind of an integrated type of work. And then I went out on my own, had my own clinic for 16 years. Along the way, I had rented from a couple different chiropractors, so I was able to observe that. And I probably took most of the classes at Upledger level 1. I didn't take like 2, 3, and 4 of everything, but I, knew enough to maybe be dangerous, or I knew enough to know a little bit about, lymph drainage and visceral and cranial sacral and things like that. So along the way, I also got my DAOM from Atlantic College, from American College of Traditional Chinese Medicine, so out in San Francisco. And like I mentioned, I retired about 4.5 years ago. So I have a very small practice. I only see maybe 30 patients a week. I used to see way over 100 a week. And I'm doing research. So this freedom has given me the opportunity to research, teach, and learn all those things I always wondered about but didn't have time for.
Wow, very interesting. And can you share with us a case where you had the best success using the knowledge that you're going to be sharing during your class?
Yeah, some of the communication techniques were great. There's a technique called the Gasku static back that I use with all pain patients that works really well. There's a few other tricks and things and techniques I've learned. One of the surprises, because I've always done Japanese meridian therapy, which is very palpation based, is that I bought a class 4 laser, and you can read about it in my article. And I started using that. And that's something I really wish I had gotten a hold of, 20 years ago and learned about. So that's really effective, I found, on neuropathy for the hands or feet, or particularly chemo or induced neuropathy. I have a lot of success with that. I can compare it to just straight needles or compare it to E-stim needles, and the laser is very superior. Also, in Florida, we have more people run around barefoot or flip-flops, so more foot pain. And the laser is just great for foot pain because of it. You don't have to needle it. It's difficult to do the soles of the feet. Also, lasers are great for needle phobic patients. It's great for additional to the NADA protocol to do the laser in the same areas afterwards. That's very effective. But in general, the laser is really great for pain management. So, there's some research on doing gua sha on the watawaji points along the spine that reduces inflammation in the whole body. Well, I found doing laser for 3 to 5 minutes on the spine has the same effect. It just reduces the inflammation in the whole body and is effective for all patients with any general inflammation, just really any patient at all. It builds their chi in their blood and increases their constitution. But I could go on all day with things like that.
That's very neat. So this is one of the modalities that you're going to be teaching about in your class. So I'm sure that there's going to be so much more information and research that everyone can enjoy.
Yes, this is a research-based type of class, and things that acupuncturists are actually doing with success in their practices. They have 6-month waiting list with just 1 or 2 things they're combining.
Oh, incredible. Well, thank you, Cameron, again for sharing your time and knowledge with us today. And as a reminder for everyone, Cameron Bishop will be teaching on Friday, August 25th at 2 p.m. This class is being offered live in person in Fort Lauderdale Beach, Florida, and it falls under the CEU category of biomedicine for a total of 3 CEU credits. Thank you again, Cameron, for chatting with us today.
Thank you.
And we will see you all at conference.